What is the link or the relationship between chronic fatigue and bone health?
So a lot of people don't realize that the causes are very similar. So oftentimes when people do have osteopenia or osteoporosis and they also have fatigue, oftentimes they don't realize that they're actually linked. So one of the things we're going to talk about today is what I call the toxic five, which are very much present in both conditions. The toxic five is a combination of heavy metals, chemicals, molds, infections, and nervous system dysfunction. Some of these directly and some of these indirectly are all going to influence the health of your bones. So heavy metals, chemicals, molds, they've all been implicated in decreasing bone health. Infections and nervous system dysfunction, in addition to the rest, are all going to compromise your hormonal systems, your HPA axis, ovaries, thyroid, etc., which in turn will compromise your bone density. Those are what I consider to be the real root causes of chronic fatigue syndrome, and now long COVID as well. And they just happen to have that crossover.
Let's talk about the first part, though, the yeast, the molds, and heavy metals. How would somebody know that that's a causal factor for them? How do they know they have that?
If they have chronic fatigue syndrome, long COVID, they all have all of the toxic five. This is what I've learned over the last decade in specializing in this work and running thousands of different laboratory tests. The toxic four, the heavy metals, chemicals, molds, and infections, pretty much all of them in every category come out over the course of a year. I don't test for these toxins anymore because everybody that I work with, I treat all of them, because the last thing that we want is after 12 months or so to say, oh gosh, I really wish that we treated molds. I don't work with a ton of people who have osteoporosis, but for the people who I do, their osteoporosis gets better, they improve their bone density, etc., when we remove the toxic five as well. So that's the crossover that I see.
Yeah, and the thing is, we're exposed our whole lives, and even more so now. I think that that's the big thing. There's a lot of invisible stuff happening in our world, in our food supply, in our air, in our water that we've been exposed to. I want to actually understand what that means. Is it linked specifically to the COVID virus, the long haul COVID, or there's so much of the toxic five present in someone's body that any virus is going to put them into this state, or is it specific to the coronavirus?
It is a combination. So the toxic five kind of sets the stage, and then the spike protein COVID virus becomes the straw that breaks the camel's back. So it does require the virus, though people traditionally, chronic fatigue syndrome and chronic fatigue really came from people having a bad flu, bad virus, a bad infection of some sort. Sometimes they're bitten by a tick or a horsefly, I've even seen, or sometimes they have exposure to mercury. They're on a swordfish diet, like Tony Robbins was at one point in time, and then he's having some issues and found out that his mercury was sky high because of all the fish that he'd been eating. So it can be from a number of these different toxins that accumulate over your life, and then all of a sudden there's something that becomes the straw that breaks the camel's back. In this case, what we're seeing the last couple of years, it's COVID and the spike protein.
So if you're not running functional labs and you want to look for some of those toxic five, what are some of the ways that you do that to find out what is the toxic burden, or is this a factor?
Over the last decade, and testing people every 3 months for all of those different toxins, I found that, initially the toxins really wouldn't come out, but at month 6, at month 9, at month 12, all of a sudden it's a waterfall of all these toxins coming out. So I use the testing more for when should we stop treatment. First off, the testing isn't great because these urine tests, they're looking at how good you are excreting. They're not really telling us the total body burden, because if you're not excreting well, it's not going to show up in the urine, which is why oftentimes, you do a test initially with somebody, nothing shows up, you do a test 6 months later, all of a sudden there's a bunch in there and they're like, what happened? Why do I have so much more in my body? And the reality is that it's just telling us that now you're excreting a lot better. And the other thing is that I know enough to know that if I address 99% of the causes that people have, we're going to leave no stone unturned and they're going to be a lot more successful. I just don't trust labs enough to give me concrete evidence for treating stuff. So I find that it's actually less expensive, saves time, and gets people better faster by just addressing all of them. So I'm addressing not just the heavy metals, all the chemicals, all the molds, but then also the infections, whether it's yeast, bacteria, virus, Lyme, parasites. We do that and it doesn't cost that much more, take up that much more time, because we're not waiting for labs to come back. We're just moving through a process where we're going to be addressing all these things. All these toxins are really bound up with each other. I call it like a toxic matrix. Heavy metals are bound to yeast. We know that chemicals and molds can be bound up to each other and then also to the infections. And so when you start to pull out, let's say, heavy metals, and you're just addressing heavy metals, all of a sudden you start to release the other toxic four, essentially addressing all of the toxic five as we move through this process. And we're doing doing it at a rate that the body can tolerate so that people don't feel worse.
And when it comes to our body storing all of these, the bones actually store some of these metals. When all of the straws are coming on the camel's back, they're starting to release bones, then sometimes some of those metals can come up and come out. And you're right. So I love your approach. If you assume from the beginning that we're all toxic, we all have potential yeast imbalance, bacteria, and parasite imbalance. We go in with balancing the body so it starts to move everything, and we chelate that or bind it, then we have a cleaner system to work through.
I absolutely agree. And I have a 4-step process that we take people through. A lot of it's prep work. Step 4 is removing the toxins and toxic 5, but the other steps are preparing you for that.
What I find, like just thinking about the way you're approaching all of this, we have conventional medicine that sees patients, gives them pills to manage the disease. My goal is to reverse disease. It's to reverse osteoporosis if you can, if you're in that zone and if you're in a place where you're able to get your bone markers to a place where we would call it osteopenia, but to at least reverse bone loss. And lifestyle plays such an important role here. So is that part of when you're preparing them? Can you tell me some of the lifestyle aspects that you work with?
Step 2 of my process is replacing deficiencies, and we include lifestyle habits in there. The deficiencies are not enough water, not enough good water, not enough good food, not enough good movement, and not enough good sleep. Oh, and then not enough good mindset. Those are the real habits that we're working on.
So what was the first step then?
First step is identifying the causes. So for people who have chronic fatigue syndrome and long COVID, we know that they've got the toxic 5, and then they have adrenal gland dysfunction and mitochondrial dysfunction, because you can't have fatigue without having all of those. And then the question is, okay, well, what other hormones are deficient or dysfunctional? And then vitamins and minerals. And then what are the lifestyle habits? So there are some things that we need to determine in step 1, like what is somebody's individual protocol going to be? It's not one size fits all, even though we're treating the toxic 5 on everybody.
You're doing that intake process to get to know the person, which, it's ironic because you were in a certain model medicine-wise at one point, which does not do a deep dive. It's a 15-minute session. Let me find what your problem is. Oops, here's this thing. Here's the pill for it. What you're doing now is that deeper dive into who's in front of me. So it's such a different approach. And then third step?
Third step is opening up the exit pathways. So this is opening up liver and kidney and lymph and neural lymph, which is the garbage system in the brain, and the gallbladder in the intestines. So this is really how we help people decrease their symptoms of die-off or Herxheimer reaction or of detox when we go into step 4. If you go too aggressively after heavy metals or chemicals or whatever, you do need to pivot back to step 3 and increase the support that you need so that we can have this flow of toxins flowing out of the body at a rate that the human can tolerate.
If you enjoyed this clip from Stronger Bones Lifestyle, be sure to check out the next video or dive into the full podcast episode. Before you go, hit that subscribe button so you don't miss a thing. Thanks for watching, and I'll see you in the next video.